Hello everyone. We celebrate World Diabetes Day on 14th of November every year. Diabetes. Nurses make the difference. Education and funding are vital to support healthcare professionals in the fight against diabetes. And right now, we need 6 million more nurses. Come, let's find out more about this deadly disease and the role that nurses play to fight against it. Diabetes. Diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose or blood sugar, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and nerves. The number of people with diabetes has nearly quadrupled since 1980. Prevalence is increasing worldwide, particularly in low and middle income countries. The causes are complex, but the rise is due in part to increase in the number of people who are overweight, including an increase in obesity and in a widespread lack of physical activity. 463 million adults, about 1 in every 11 people, were living with diabetes in 2019. The number of people living with diabetes is expected to rise up to 578 million by 2030. Diabetes caused 4.2 million deaths worldwide in 2019. Diabetes is a major cause of blindness, kidney failure, heart attacks, stroke, and lower limb amputations. 2/3 of people with diabetes live in urban areas, and 3/4 are of working age. More than 3 in 4 people with diabetes live in low and middle income countries. And finally, diabetes was responsible for at least $760 billion in health expenditure in 2019, 10% of the global total money spent on healthcare. World Diabetes Day. World Diabetes Day, or WDD, was created in 1991 by International Diabetes Federation and the World Health Organization in response to growing concerns about the escalating health threat posed by diabetes. World Diabetes Day became an official United Nations Day in 2006 with the passage of United Nations Resolution 61/225. It is marked every year on 14th November, which is the birthday of Sir Frederick Banting, who co-discovered insulin along with Charles Best in 1922. The campaign is represented by a blue circle logo that was adopted in 2007 after the passage of the UN resolution on diabetes. The blue circle is the global symbol for diabetes awareness. It signifies the unity of the global diabetes community in response to the diabetes epidemic. Nurses and diabetes. According to the World Health Organization, or WHO, nurses account for 59% of health professionals. The global nursing workforce is 27.9 million, of which 19.3 million are professional nurses. The global shortage of nurses in 2018 was 5.9 million. 89% of that shortage is concentrated in low and middle income countries. The number of nurses trained and employed needs to grow by 8% a year to overcome alarming shortfalls in the profession by 2030. Nurses make the difference for diabetes. As a highly valued member of the community, nurses do outstanding work to support people living with a wide range of health concerns. People who either live with diabetes or are at risk of developing the condition need their support too. People living with diabetes face a number of challenges, and education is vital to equip nurses with the skills to support them. The International Diabetes Foundation wants to facilitate opportunities for nurses to learn more about the condition and receive training so that they can make a difference for people with diabetes. An online course titled The Role of the Diabetes Educator is available to help nurses assess what they know about diabetes and improve their knowledge and understanding of the condition. You can just log on to www.idfdiabetesschool.org/short course/diabetes educator in order to get this online course. Nurses make the difference for diabetes. As the number of people with diabetes continues to rise across the world, the role of nurses and other health professional support staff is becoming increasingly important in managing the impact of the condition. Nurses are often the first and sometimes only health professional that a person interacts with, and so the quality of their initial assessment, care, and treatment is vital. Nurses play a key role in diagnosing diabetes early to ensure prompt treatment, providing self-management training and psychological support for people with diabetes to help prevent complications, tackling the risk factors for type 2 diabetes to help prevent the condition. There remains a significant need for more education and funding to equip nurses around the world with the skills to support people living with diabetes and those at risk of developing type 2 diabetes. Diabetes, types and causes. Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin that it produces. Insulin is a hormone that regulates blood sugar. Hyperglycemia, or raised blood sugar, is a common effect of uncontrolled diabetes, and over time leads to serious damage to many of the body's systems, especially the nerves and blood vessels. The causes are complex, but the rise is due in part to increase in the number of people who are overweight, including an increase in obesity and in a widespread lack of physical activity. The main types of diabetes include type 1 diabetes. In this case, the body does not produce enough insulin. In type 2 diabetes, the body produces insulin, but it cannot use it well. Another kind of diabetes is gestational diabetes, which is a temporary condition in pregnancy. What are the consequences of type 1 and type 2 diabetes? Diabetes can lead to complications in many parts of the body and increase the risk of dying prematurely. Conditions such as stroke, blindness, heart attack, kidney failure, and lower limb amputations are some of the consequences due to the disease called diabetes. Risk factors for type 2 diabetes. Genetics, age, and family history of diabetes can increase the likelihood of becoming diabetic and cannot be changed. But some behaviors that can increase risk are unhealthy diet, 1 in 3 persons everywhere is overweight, physical inactivity, obesity, 1 in 10 people around the world are obese. Prevention. Simple lifestyle measures have been shown to be effective in preventing or delaying the onset of type 2 diabetes. To prevent type 2 diabetes and its complications, people should 1. Achieve and maintain a healthy body weight. This can be calculated by using the BMI index. 2. Be physically active, doing at least 30 minutes of regular moderate intensity activity on most days. More activity is required for people who want to control their weight. Number 3, eat a healthy diet, avoiding sugar and saturated fats. And number 4, avoid tobacco use. Smoking increases the risk of diabetes and cardiovascular diseases. So the important tips for everyone is eat healthily, be physically active, avoid excessive weight gain, check your blood glucose if you have doubts regarding diabetes, and finally, follow medical advice from doctors and nurses. So, for more details about World Diabetes Day or the different conditions that are coming and affecting us due to diabetes, you can always visit the website www.worlddiabetesday.org/about. So this talks about diabetes in general and World Diabetes Day in particular. So be a part of the change to eradicate diabetes.